It is Wednesday, April the 22nd. There are now 17 known cases of the coronavirus in the town of Palm Beach. Sadly, 2 of our residents have passed away of the coronavirus. I'm Tim Malloy with the Civic Association. Here's the latest. There are a number of testing labs, as you well know, offering to come to your home or your apartment building to do the coronavirus test, as well as the other tests to tell whether or not, in fact, you've actually had it. Well, Town Manager Kirk Blumen, who I spoke to at length this morning, is concerned, not about that practice necessarily, but about the fact that the county health department is not receiving the results of those tests. As you can imagine, that is vital to tracking the virus and the prevalence of it, who has it, who hasn't had it. So it's not always be done, and that is troubling. We are in, of course, still the stay-at-home, shelter-in-place situation where you're really supposed to limit your activity beyond going to the store, the doctor, the veterinarian, or the pharmacy, and of course get some exercise. That having been said, a lot of people are not wearing masks. They should. They were given 20,000 of them were given out over the weekend, and there's really no excuse for it, but it's not the law. You don't have to. We just encourage you to do so. Here's Kurt Blumen on the upside of that, and a lot of people who are doing exactly what they should be doing.
If you're looking for violators, you're going to find them. You'll find what you're looking for. But when you look at the population numbers here in Palm Beach County and 1.8 million, and if you look at it through those set of lenses, I see people mostly cooperating here, obviously here in the town and in the county with those recommendations and with those orders. I think people are getting somewhat tired. They're getting restless. They've been isolating and distancing for quite a long time now from their family or friends, and they're anxious to get out. Some people are better at following direction than others. But for the most part, I think it has been a success.
And now some interesting, important, and heartbreaking information from the front lines from a doctor in New York who's actually from Palm Beach originally, what it's like to be in a Brooklyn hospital and what you should be doing to take care of yourself. Take a look.
My name's Dr. Laura Pasillo. I grew up in Palm Beach, and my parents, Michael and Debbie Pasillo, still live there. And I am currently in my residency in Brooklyn, New York, working at a hospital that's treating a large number of COVID patients at the moment. We've had over 500 already discharged and still have somewhere close to 500 patients admitted with COVID. So I've been seeing a lot of it. And I heard that Palm Beach was sending out videos to update citizens on COVID and wanted to provide any help if I could. So one of the things that I wanted to show you guys, I know that a lot of people are wearing masks and gloves around and don't necessarily know how to use these PPE measures because you don't in your regular life. But just a quick note on that, make sure that you're never contaminating anything by wearing your gloves. So if you're gonna wear your mask, this one, or one that has like the strings that tie around your head, try never to touch this blue surface of it, because that's the part that can be contaminated by somebody breathing near your face, and try and just touch the outside parts. So if you have something like this, put it on, make sure that it covers both your nose and your mouth, and that it's pretty tight here. And then if you put gloves on, like these, everything that you touch from this point on, basically assume that it is COVID. So if I was to touch something at the store, like this, for example, I touched this and now this glove is dirty. If I touch my face, if I touch my mask, if I touch myself, my clothes, anything that I've touched with this is now dirty. So you have to be careful about that when you are wearing gloves to make sure that your hands remain isolated. And when you're done with your shopping or whatever you've been doing out in the world, you can take your gloves off by going like this, close it in on itself so that all of the germs are now contained. Put it in your other hand, and then take 2 fingers underneath this and do the same and wrap up like that. Now everything that was on the surface of those gloves is inside. And then when you want to remove your mask, always do it from the sides or untie from the top. Go like that. Then take it off and then try not to touch the blue part. So I think if you can do that in your community, you can hopefully stop more spread. This disease, I know you guys are all probably seeing a lot on the news. If I can add anything to it, it's just that it is worse even than what the news says. So I would say that take this very seriously. Please stay home. Please stay in your homes. Don't go out if you don't need to. Don't socialize with people who do not live in your home. I know it's difficult. I can't imagine how hard it is to stay in your home every day, but I can tell you that it's worth it. It is going to be worth it if we can at least stop the spread of this disease until the medical community understands it more, has more treatments available, potentially has a vaccine available. just please give us some time. We are doing as much as we can, but we don't have enough answers yet to protect enough people. So please stay home. And then if you have other questions about COVID, reach out to your doctor. If you think you might have symptoms like fever or cough, reach out to your doctor. The biggest, scariest thing is obviously difficulty breathing or shortness of breath. That would be a reason to seek medical attention immediately. But if you're feeling well, stay home and keep feeling well.
One of many courageous doctors in the very vortex of the coronavirus in New York City. In the world of science and medicine, there's no doubt that there are many organizations and institutions scrambling to find a vaccine, something to stop this for good. Scripps is doing that right in our own backyard. Here's Wendy Rutledge.
Tim, the research scientists at Scripps are really moving forward on a number of fronts related to the coronavirus pandemic. They are making headway in terms of developing a vaccine that, of course, would prevent people from getting COVID-19. In addition, they're looking into developing antiviral drugs that, if you did get sick, these would be used as treatments. So this afternoon, we sat in on a very informative Scripps webinar explaining all of this exciting research.
But this current virus, SARS coronavirus 2, COVID-19 virus, this virus absolutely flunked Immunology 101. And because of that, we have all this knowledge and we have all the scientific tools we need to defeat it. And again, our bottlenecks are just testing, manufacture, and distribution. The first thing that happens for the virus to get into the cell is it kind of latches on this receptor, we call it ACE2. We always understood that ACE2 was on the lower respiratory tract, but it was only in this new infection we began to appreciate the degree to which ACE2 is present in your nasal epithelium. And this is very important for a couple of reasons. One is it helps to understand the very unusual distribution of disease severity that associates with COVID-19. Some people get very sick from this virus, and a lot of people don't get very sick from this virus. They have what we call upper respiratory tract infections. You got a little nasal drip and maybe a cough. Whereas if you get into your lower respiratory tract, you could have inflammation and very serious pneumonia, and that's the beginning of how you might die from this. Most coronaviruses actually transmit through the oral fecal route. Almost for certain, we got this virus because a bat pooped on either a human or intermediate species that then transmitted to humans. Oral fecal is the primary route by which these classic coronaviruses transmit in the wild. Antibodies will be very, very useful in protecting people from infection as well as treating an ongoing infection. Your immune system sees a pathogen or a vaccine, it's going to start making the antibodies. But then we got to start thinking about what these antibodies do. Now, the most important antibodies bind the most important or the most accessible protein on the virus, and that's the spike protein. And when it does so and it blocks the activity of the spike protein, we call that neutralization. And these are the best class of antibodies. We would say at Scripps, we're not necessarily making a vaccine. What we are doing is telling people who make vaccines what is the best thing to target.
A couple of quick item news, non-coronavirus. The marina, the town marina, about to be under major renovation. Great change coming, will be closed as of May the 1st. It is not expected to be completed until September of next year, 2021. Much larger boats will be accommodated there. There'll be floating docks. When completed, the project should net the town north of $10 million annually from that project. There are concerns of another kind, and it's kind of a perennial one in our town, but more so right now given the situation. Car break-ins. There are a lot of them around town. Police urging you to make sure you lock your vehicle. This is no doubt an extremely stressful time for all of us. A lot of anxiety in our community. Absolutely nothing to be ashamed about with that. There is help a phone call away, and Wendy Rutledge has more on that.
Tim, here is a new term for you, telemental health. It is a way that people can get some mental health therapy without having to leave their homes. And of course, in this era of COVID-19 isolation, many of us are feeling anxious, frustrated, and have a higher need for this than usual. Now, Palm Beach County is actually offering a number of telemental health services for free that we thought you might want to know about. The Education and Training Center is offering family therapy, individual therapy, and parenting support through Zoom teleconferencing. For an appointment, call 561-233-4460. Youth and Family Counseling, known as YFC, also offers family and one-on-one counseling also through Zoom. Their number for an appointment is 561-242-5714. For more information about telemental health, you can visit Palm Beach County Youth Services website.
Again, we're in a shelter-in-place mode. As we all know, shelter-in-place means keep social distancing. Only go out when you absolutely have to or you need a little bit of exercise. And please wear a mask. A lot of people aren't. You really should be. It's not the law, but it is advised. Look around. Start doing it. We will be cutting in periodically. We wish you well, and we leave you now, as always, with our beautiful Atlantic Ocean.